What would you do if a heart attack struck and you were completely alone? It's a chilling question, but one that more of us over 60 should ask ourselves. Statistics show that a significant portion of heart attack fatalities occur before medical help ever arrives, especially among seniors living alone. The first few minutes after symptoms begin are the most critical. Every second your heart muscle goes without adequate blood flow increases the risk of permanent damage or death. Yet, a heart attack doesn't have to be a death sentence, even if you're by yourself. In this video, you'll learn 7 simple, practical, and potentially life-saving steps you can take immediately when you suspect a heart attack, all without medical training or fancy equipment. By the end, you'll know exactly what to do, from recognizing subtle warning signs to using your phone to your advantage, so you can buy yourself the precious minutes you need. Let's dive in. Number 1. Recognize the early signs before it's too late. Contrary to Hollywood's depiction, a heart attack rarely arrives with thunderous drama. There's no booming soundtrack, no cinematic collapse. Instead, it often begins with subtle, almost deceptive signals. You might feel a vague pressure, a tightness or a squeezing sensation in the center of your chest, like a heavy weight is pressing against your sternum. It may radiate to your jaw, neck, shoulders, or back, manifesting not as a sharp jolt but as a dull, persistent ache. You could experience a cold sweat, dizziness, or sudden nausea symptoms that mimic a flu or a bad day. Shortness of breath and overwhelming fatigue can descend without warning, making climbing a single flight of stairs feel like scaling a mountain. In fact, a 2023 study found that nearly 30% of seniors experiencing a heart attack reported only mild discomfort rather than crushing pain in their chest. Consider the story of Margaret, a 72-year-old retired teacher who loved tending her garden. One early morning, as she knelt to prune her rose bushes, she felt a fleeting tightness across her chest and a strange weariness wash over her. It wasn't painful, just uncomfortable, like she'd run a marathon in her sleep. Rather than dismissing it as age or fatigue, she paused, pressed her hand over her heart, and took note of the sensation. Within moments, the tightness subsided, but her instincts urged her to call for help. She dialed emergency services, describing her vague symptoms. Paramedics arrived within 7 minutes, and tests confirmed that she was indeed having a mild heart attack. Thanks to her prompt action, doctors were able to restore blood flow quickly, and she walked out of the hospital within 3 days, her heart unscathed by the attack. The takeaway is simple: trust your instincts. Don't wait for the pain to become unbearable. If something feels off, no matter how slight, act immediately. Early recognition saves lives. And while you're thinking about your heartbeat, think about subscribing below. This channel brings you vital, potentially life-saving information every week. Number 2. Call emergency services immediately. The most critical step in a suspected heart attack is to summon professional help without delay. In the United States, dial 911. Keep it on speed dial or programmed into your phone's favorites. Call emergency services first before you call a family member, friend, or doctor. The reason is straightforward: every minute of delay allows more heart muscle to die. Paramedics arrive with oxygen, advanced cardiac life support, and medications that begin treatment on the spot. They can monitor your vital signs during transport and alert the hospital to be ready with a catheterization lab or surgery team. Resist the urge to drive yourself or have someone else drive you. Fainting behind the wheel or on the roadside can turn a recoverable heart attack into a fatal car accident. Instead, lock your door, keep your keys within reach, and make the call. If your phone is locked, remember these shortcuts. On most smartphones, pressing the power button 5 times or swiping the lock screen opens the emergency dialer without needing a passcode. Even if you're trembling, you can make that call. Take the case of Miss Thompson, a 68-year-old widower living alone. One afternoon, he felt a squeezing in his chest and a wave of nausea. Remembering a brief pamphlet from his doctor's office, he dropped what he was doing and called 911 immediately. The dispatcher guided him through turning on speaker mode and keeping the line open. By the time the paramedics arrived, they'd already administered aspirin and nitroglycerin prescribed beforehand, stabilized his blood pressure, and were ready to transport him. Thanks to those quick minutes, he underwent angioplasty that same afternoon and returned home with his heart's blood flow fully restored. Number 3. Chew an aspirin. Don't swallow. Aspirin is a household staple, but in a heart attack, how you take it matters. Instead of swallowing a tablet whole, chew it thoroughly. A full-strength, 325 milligram non-coated aspirin dissolves and enters your bloodstream faster when chewed, inhibiting platelet aggregation, the process that forms dangerous blood clots. Imagine your coronary arteries as highways with traffic jams. A clot is like a block of cars that stops blood flow to your heart muscle. Chewing aspirin helps clear that block at least partially, providing precious time until advanced medical care arrives. Here's how to do it. Keep a bottle of aspirin near your bed, another in the kitchen, and perhaps a small packet in your wallet. If you feel any suspicious chest discomfort, reach for the aspirin right away, even if your hands are shaking. Pop a tablet into your mouth, chew until it feels like a paste. Then swallow with a sip of water if you can. It won't reverse a heart attack, but it will reduce its severity. Mrs. Patel, age 70, learned this lesson the hard way. Several years ago, she experienced mild chest tightness, but ignored it as indigestion. When the pain intensified an hour later, she called for help, but by then significant heart muscle damage had occurred. After her recovery, she vowed never to underestimate aspirin's power. She now keeps tablets strategically placed and knows exactly how to chew and when to do it. When the next episode struck, she chewed the aspirin within seconds, and paramedics found her condition far less critical than before. Number 4. Sit or lie down immediately. Every movement, standing, walking, or even sitting up, forces your heart to pump harder against gravity, increasing its workload at precisely the wrong moment. At the first hint of a heart attack, find a safe place to sit or lie down. If you choose to sit, select a sturdy chair with back support. Lean back and rest your arms on the armrests or your lap. Keep your feet flat on the ground, shoulder width apart. This posture helps maintain blood flow to your brain and reduces the risk of fainting. If you feel dizzy or weak, lie on your side with your head slightly elevated on a pillow or folded blanket. This position not only reduces strain on your heart, but also ensures that, should you lose consciousness, you're less likely to choke. In no circumstance should you attempt to power through the symptoms. Rest is not weakness. It's a life-saving tactic. Take Margaret's experience after calling 911 and chewing aspirin. She had to walk back to her house from the garden. She paused halfway, remembered to sit on the concrete steps, and leaned against the porch post. The stillness kept her conscious and calm until the ambulance arrived moments later. Moving impulsively could have dropped her blood pressure dangerously low, risking collapse before help arrived. Number 5. Unlock your door. Time is life in a heart attack. When paramedics arrive, you want them stepping into immediate care, not fumbling with locks. If walking to the door doesn't worsen your condition, unlock it the moment you suspect trouble. That way, when help arrives, they can enter without delay or forced entry, which can waste precious minutes. To prepare, make sure your house number is clearly visible from the street on the mailbox, door frame, or a garden plaque. Consider installing a lockbox with a spare key, or upgrade to a smart lock you can open via your smartphone. Tell a trusted neighbor where your spare key is stored and arrange for them to check in if they hear your emergency call. These small preparations can shave off critical time. Of course, if walking to the door is too taxing, skip this step and focus on sitting or lying down. But if you can manage it safely, unlocking your door is a simple, proactive measure that ensures there's no barrier between you and the life-saving team. Number 6. Use your phone's speaker and medical ID. When you dial emergency services, switch your phone to speaker mode. This hands-free setup allows you to breathe calmly, keep your hands free for aspirin or adjusting your posture, and enables the dispatcher to hear any changes in your breathing or voice. They're trained to detect signs of respiratory distress and can adjust their instructions accordingly. Next, set up your smartphone's medical ID feature, accessible even when your phone is locked. On an iPhone, open the Health app, tap Medical ID, and fill in your name, birth date, medical conditions, allergies, medications, blood type, and emergency contacts. Turn on Show When Locked so paramedics can access it without your passcode. Android users can find emergency information under Settings. The setup is similar. Consider Mr. Cheng's story. He collapsed one evening after dinner. His daughter had already entered his severe penicillin allergy, his pacemaker details, and his daily medications into his medical ID. Paramedics, finding him unconscious, opened his medical ID from the lock screen and immediately knew which drugs to avoid. They treated him appropriately, and he recovered without complications. Without that information, they might have administered medication that caused a life-threatening reaction. Number 7. Breathe slowly to calm your heart. Panic is your enemy during a heart attack. Adrenaline floods your system, driving your heart rate and blood pressure higher, precisely when your heart needs rest. The antidote is controlled, deliberate breathing. This simple practice engages your parasympathetic nervous system, helping to slow your heart rate, lower blood pressure, and maintain oxygen flow to critical organs. Here's the technique. Inhale slowly through your nose for a count of 4, hold for a count of 2, then exhale gently through your mouth for a count of 6. Focus on lengthening your exhale. This has a more powerful calming effect than the inhale. Repeat this cycle for several minutes, or until you feel steadier. Make this a daily habit. Practice during your morning routine, while reading, or when you're watching television. The more ingrained it becomes, the more instinctive it will feel under crisis. Ms. Alvarez, a 69-year-old retired nurse, credits her calm breathing practice with buying her the 10 extra minutes she needed before help arrived, preventing a full cardiac arrest. She says that focusing on each breath calmed her mind and body, giving her the presence of mind to chew aspirin, call 911, and unlock her door. You now have in your hands 7 life-saving steps that can stand between you and a fatal heart attack. Recognize the early signs. Call emergency services immediately, chew aspirin, sit or lie down, unlock your door, use your phone's speaker and medical ID, and breathe slowly to calm your heart. Knowledge without action is like a fire truck without water. Useless, so practice these steps today. Program your phone's emergency features. Store aspirin within arm's reach. Test your medical ID. Make a plan for unlocking your door or sharing a key with a neighbor. With these preparations, you transform from a passive potential victim into a proactive guardian of your own life. You become the one person who can prevent a tragedy, even when you're alone. If you found this guide invaluable, type "ready" in the comments below to show you're committed to your health and safety. Subscribe to stay informed with our weekly life-saving tutorials, and share this video with someone over 60 who lives alone. You may just save their life. Remember, you are not helpless. You are prepared, and in those precious critical moments, preparedness isn't just power, it's survival.